Hello, coders. Today we're going to talk about pathology and laboratory, or path and lab for short. So, unlike a lot of our other sections that we've talked about, like surgery and evaluation management and radiology, we can do a couple different things here that we're not used to looking for. So, like always, we can always look up the procedure name. If we're doing something like a hemogram, we can look up hemogram. This is one of the big sections. We're going to be able to look up abbreviations and acronyms. We're going to be able to look up things like ALT. We're going to be able to look up ABG. We're going to be able to look up, the CG for growth hormone and all of this type of stuff. And if there's not a code next to the abbreviation or acronym, it's going to tell us where to go. The other thing that we can look for, which is a little different, is we can look for the microbe or the product in the blood itself. So we can look for everything from bacteria, viruses, fungi, parasites. We can also look for different parts of the blood. We can look for hemoglobin. We can look for different globulins. We can look for sugars. We can also look for things like drugs, like cocaine metabolites and alcohols and all sorts of stuff like that. So there's a lot of different terms here. One of the things I would suggest that you do is take all of these terms that I'm giving you, and you might want to highlight them in a very specific color. And there's also some subdivisions that we're going to look under. So when you go into the word blood, we're going to be able to find codes under blood, blood banking, blood cell count, blood cell, coagulopathy, clotting factors. And again, for coagulopathy, these are going to be for, how fast does the blood clot. For the clotting factors, those are for people that have different types of like hemophilias. Blood gases, again, we have oxygen, we have nitrogen, we have others that we can look in the blood. You can look up blood product because we're going to have some blood products that come from this section. But be careful, because if you look at the hepatic, lymphatic, mediastinum, and diaphragm section, what you'll notice is that there are very specific progenitor cells that are used for that section versus this is going to be more for blood itself. There's also the blood typing, which is done serologically. They do this again when you're pregnant and when we need to know the blood type for surgery. We can also look under breath test. This is something that's becoming more and more common. What they're finding is that there are different drugs that if you have the person swallow it, it will interact with what's inside the stomach, and when they breathe out, we can test for things like H. pylori, the Helicobacter pylori. We can also do things like C. urea through a breath test as well. We are going to talk about some of the chromosomal testings and some of the genetic testings. The biggest thing to know is we can look into things like chromosome analysis and chromatography. As we go a little bit further, we'll talk about the other ones. Because we do have some consultations here where we can look under consultation. Again, we can culture if we're looking for something like fungi, yeast, things like that. You can look up cytogenic studies. So again, looking into the cells, the genetics within the cells. Cytopathology, which we do a lot for things like pap smears. We can look up both drug and drug assay, because again, we can look for both what we call therapeutic drugs and for other drugs that we want to make sure someone's not taking, such as cocaine, heroin. We're going to have what I call mini panels. They're evocative and suppression tests. Basically, what we're doing is we're looking at a series of endocrine secretions, and we take tests before and after we give them a drug to either evoke or suppress that specific gland. Along with, all the other genetic testings, we can look under gene analysis. One of the big ones is under genomic sequencing procedures and other molecular multi-analyte assays. Again, only if you work for a facility that really does extensive genetic tests will you even see these in the field. You can look up, again, when I was saying parts of, the blood, you can look up a globulin or hemoglobin, things like that. You can also look up the hormones, which again are coming from our endocrine system. the immunoglobulins, the immunoassays. So again, different ways that we actually perform these procedures. So when we're looking for our microorganisms, our bacteria, viruses, our parasites, and our fungi, certain ones are done in certain ways to get a better test. So we're going to have to know sometimes, are we doing this by immunoassay technique, immunodiffusion, immunoelectrophoresis, immunofluorescent microscopy? Again, they'll have to tell us. Now, under the term infectious agents, you will also see these 4 subterms that you may also want to highlight as a helpful way: antibody detection, immunofluorescence, immunoassay, and nucleic probe. Again, these are all different ways of us looking into the infectious agent. Again, because we have 3 main types of blood cells in our body. We have red blood cells, white blood cells, and our clotting cells, platelets. We can look up things like leukocyte. As again, when we get to some of our other genetic testing, we have things like next generation sequencing and other molecular multi-analyte assays. Again, different techniques, nucleic acid probe, and again, these are the techniques that they are using in the lab itself. For some of our panels that we're going to start talking about, we can look under organ or disease-oriented panel. Again, if we're looking for something specific, we can look under something like parasites. Under the main terms of pathology and laboratory, there are a lot of subterms. These are the ones that I suggest that you highlight because it will help you find your way. The first thing is under pathology and laboratory, chemistry goes on for multiple pages, not just multiple columns, but actually multiple pages. So I always suggest that you highlight under pathology and laboratory, chemistry, cytopathology, evocative suppression test, microbiology, surgical pathology, and transfusion medicine. Those help you kind of navigate through the pathology and laboratory section. Again, we can look up specific types of parasites like pinworms. We can also look at things like protein, again, red blood cells, reproductive tissue, because we do have some of our reproductive medicine in this section. We can look up smear and stain because, again, we do smears and we do stains to see what's going on with the cellular structure. We can look up things like T cells. We can look up things like test, which is a very kind of vague, but can help us get to where we want to go. Thawing, again, because, again, we're doing a lot of cryopreservation. We need to thaw blood products. Therapeutic drug assays, which is, again, something that's prescribed to a patient, but we want to make sure they're taking it and that their body's absorbing it. We can look under tissue. Again, urea nitrogen's another big one we test for. Urinalysis, for testing things in our urine. We can look up vitamin, white blood cell. And so, again, lots and lots of different ways we can look these up. So one of the ways I like to think about when I'm looking at a patho lab example is this testing something specific or is a little more vague? So if they say we're doing a therapeutic drug assay on gabapentin, then I know I can look under therapeutic drug assay. However, if instead we're looking at an eosinophil smear, I know I can look under smear. You know, so again, as you go through, definitely become more familiar with these different sections. So the first thing you're going to notice is we have this molecular pathology gene table. Now, again, the biggest thing with the gene table, it starts on page 492, unless you work for a facility that specifically does these genetic tests. And these are very expensive tests that need very large machines that can do processing. These are very expensive machines. However, UConn in Farmington, Connecticut just put in one. There's one right outside of Boston. Almost every major city has one relatively near, but there are some states that don't have any, and we have to send them to another state. So again, sometimes you'll be doing the processing of it, meaning the taking of the blood or urine or sample, but then we're sending it to somebody else. Now, when it comes to the molecular pathology gene table, a couple of things you need to know, and we'll go over this again when we get to these codes. The Human Genome Project has created everything that you see in this table. They've created the claim designation, what they're calling it, the abbreviated name, if there is one, the full gene name, which half of them are really difficult to say because they're getting into all the complexities of the molecular processes. If they have a commonly associated protein or disease, they put it with that. And then the CPT codes that go with this. This consistently has been updated since they first put it in the book, because now that we understand a little bit more about a lot of these, these genes, we're able to understand more. And so this, as you can see, it goes on for many, many pages, and it finally ends on page 509. So just as an idea, something you may want to do, I always do this, I put my Path and Lab tab on the page that starts with the codes. So that means my Path and Lab tab is on page 511, because that's where the codes start. Okay, now, when you look at the green guidelines on page 510, there's not a ton. A lot of it's stuff we've seen before. Again, in this case, this could be a physician or technologist under supervision of a physician. So for instance, if this is someone who's working in the laboratory, they're still working under a doctor, even if the doctor is not standing right next to them. We also have our separate procedures, which reminds us that we can have multiple procedures on the same date, and sometimes we have a lot of these. Sometimes we only have one or two. It depends on what's needed for the patient. Then a list of our unlisted procedures. Again, the shortcut for all unlisted codes for each section is going to be found in the green guidelines before that section. And then a reminder about special reports. But the first thing we're going to see is these organ or disease-oriented panels. So the first thing that we want to keep in mind is, what do we use these for? So as it tells us, these panels were developed for coding purposes only and should not be interpreted as clinical parameters. The tests listed with each panel identify the defined components of that panel. So in a couple sections where we have panels, underneath the explanation of the panel, it will list what we're looking for in each panel. Now, again, these are for coding purposes only, meaning the doctors can use these or not use them. We have to remember the CMS 1500 form for the last couple of iterations, going back into the 80s, has only had 6 slots for procedures. So this was one way that we're able to easily identify a series of blood tests all grouped together. So again, doctors do not have to base everything they want on these panels, but doctors have been asked, and they're consistently given questionnaires to say, okay, what tests are you giving for groups of patients? And again, trying to make it easier on both sides. Now, these panel components are not intended to limit the performance of other tests. If one performs tests in addition to those specifically indicated for a particular panel, those tests should be reported separately in addition to the panel code. So, each one of these main codes has a list of what's included. If we do something in addition to that panel, we code it in addition to, okay? So that's what we want to keep in mind. Where it gets a little confusing is this next part. Do not report 2 or more panel codes that include any of the same constituent tests performed from the same patient collection, okay? If a group of tests overlap 2 or more panels, report the panel that incorporates the greater number of tests to fulfill the code definition, and report the remaining tests using the individual test codes. Like, do not report 80047 with 80053. And the reason is 80047 is called the basic metabolic panel calcium ionized. So it includes the following: calcium ionized, carbon dioxide, chloride, creatinine, glucose, potassium, sodium, and urea nitrogen. 80053 includes albumin, bilirubin, calcium total, carbon dioxide, chloride, creatinine, glucose, phosphatase, potassium protein, sodium, transferase, which is ALT, and AST, and then the blood urea nitrogen. Again, there's an overlap, okay? We can't code the two together. What we would do is we would code the panel that has the highest amount of tests included and code everything else separately. So what you'll see here is you will see the code that goes with the panel. So the code descriptor here, this is a basic metabolic panel, calcium ionized. Now, underneath, it must include all of the following. It gives you the name of the test and the code. So 82330 is what we would find if all we were doing is testing calcium ionized for the patient. But if we are testing the calcium, the carbon dioxide, the chloride, the creatinine, the glucose, potassium, sodium, and urea nitrogen, we do not code them separately. We use one code, 80047. I call these as cheat codes because this tells you where you're going to find this code. Okay, but remember, our codes are always bolded. So this information is just giving you the inclusion. This is different from other stuff that we've seen in the book. Okay, mostly when it says it will have guidelines that say it includes this, it doesn't include that. In this case, the code itself tells us what is included. Okay, you'll also notice that 80047 is a calcium ionized basic metabolic panel, while 80048 is a calcium total metabolic panel. The only difference between them is how we're looking at the calcium. Okay, if the doctor was to check off both of these, number one thing I would double check is, was it a mistake? Okay, then we would do one of the panels and code the other calcium with it, because again, we can't code two panels that have any overlapping codes. Okay, so like we can't even code 80047 with 80051 because they overlap with the carbon dioxide, the chloride, the potassium, and the sodium. Okay, so again, as long as they don't overlap whatsoever, then we can code them together. So for instance, we could code the electrolyte panel, which is 80051, with the acute hepatitis panel 80074, because the acute hepatitis panel includes hepatitis A antibody, hepatitis B core antibody, hepatitis B surface antigen, and hepatitis C antibody. And none of those tests overlap with any of the tests listed under 80051. So again, it's being careful in making sure the doctor or provider themselves didn't check off two by mistake. So again, here you're going to see calcium ionized, and these are all of the tests that are included, okay? Again, calcium total here, the only difference between these is how we're actually looking at the calcium. So when we're looking at the ionization of the calcium in the machine, and when we're looking at the total calcium in the machine. Now, most of these tests, most of them, will be done by putting the blood into a machine and having the machine run the results. However, on occasion, we will have somebody in the lab look more specifically at things like the white blood cell count, especially if we're worried about infection, inflammation, things like that. Now, when you get up to code 80050, I have a weird little notation here. And that's because we have, again, two choices when it comes to the white blood cell count. Now, this is what's really weird about this. 80050 includes everything that's in 80053, as well as the thyroid stimulating hormone, but just one of these. The difference between these is automated differential white blood cell count or appropriate manual differential white blood cell count. So again, if the provider is more worried that the patient might have inflammation, infection, they're looking for something specific within the white blood cells, they will have someone do a manual differential, which means that someone in the lab is putting a drop of blood on a slide and physically counting how many white blood cells are in that sample, versus the automated differential is the machine doing it. So again, this is an either or. So a lot of times, again, we don't get this until after they've run the test. After they've run the test, they're going to tell us whether or not they did an automated or a manual differential. And we'll see this a couple of times. We'll see it in the obstetrics panel coming up, because again, it depends on what we're looking for. I also just want to point out, because I did not take a picture of this. On page 512, the lipid panel includes cholesterol, serum total, lipoprotein direct measurement, high density cholesterol, which is the HDL, and triglycerides. I always write LDL, which is code 83721, underneath 80061, because a lot of times when doctors run the lipid panel, they also want LDL. Instead of having to go and try to find it, it's right there as a shortcut in your book. Remember, the HDL is the bad cholesterol. That's what can clog up our arteries and lead to things like atherosclerotic heart disease and stuff like that. The LDL is the good cholesterol. That's the stuff we get from like nuts and certain fatty fishes and stuff like that. So again, as you continue to code in the field, see what your doctors tend to put together. You can make your own shortcuts in your book. So for this, I would look under blood test, and then it will say panel. And then it will have all the names of all the different panels. Now, as we get to page 513, we see some guidelines up top, and then we have a whole definitions and acronym conversion listing. Again, that's something you should definitely go through. It's very helpful. And a lot of the things I'm going to be talking about, like what's an immunoassay, or, what does a substance mean? All that is in here to help you, especially some of the general categories of drugs. So we have two main types of drug assays. We have the therapeutic drug assays, which are for drugs that we put in the patient by prescription. There are the drug assays, which are looking for things like illegal drugs and other over-the-counter services, and chemistry, which is when we look at different types of drugs that could be in the body, think like heavy metals like lead. Now, the code selection is dependent on the purpose and the type of patient results obtained. Therapeutic drug assays are performed to monitor clinical response and are known prescribed medication. The two major categories for drug testing, so therapeutic drug assays we'll look at in a few minutes, are either presumptive drug classes, which are procedures that are used to identify the possible use or non-use of a drug or a drug class. A presumptive drug test may be followed by a definitive drug test in order to specifically identify drug metabolites. So I know it's hard to see here, but I put a positive or negative. This is either the person has it or they don't have it in their system. That's the presumptive, okay? The definitive, as it goes on to tell us, procedures are qualitative or quantitative tests to identify possible use or non-use of a drug. These tests identify specific drugs and associated metabolites if performed. A presumptive test is not required prior to a definitive drug test. So again, if the doctor offers a definitive drug test, we're doing a definitive drug test. However, think more pre-employment testing. Pre-employment testing might say, we're going to do a drug test, and if, let's say, the urine test comes out with a positive for a metabolite like cocaine, heroin, opioids, etc., then we can then do a definitive drug test to see how much is in there. Now, this is the big thing. Material for drug class procedures may be any specimen type unless otherwise specified in the code descriptor, like urine, blood, oral fluid, which is usually saliva and or mucous membranes, meconium, so again, that's baby's first bowel movement, and hair. Procedures can be qualitative, which is positive, negative, or present absence, semi-quantitative or quantitative, which is measured how much, depending on the purpose of the testing. Therapeutic drug assay procedures are typically quantitative tests, and the specimen type is whole blood, serum, plasma, or cerebrospinal fluid. So again, the differences between them is this a therapeutic drug that is prescribed that they're supposed to be taking, or is this another type of drug that's not really supposed to be in their system? And again, we could be doing this because the patient's on a chronic pain med, or maybe we are working at the facility that's helping the patient deal with their different abuse issues. So I'm going to skip right down. So when we're looking at the drug testing, okay, so these all start on page 516.